Hi, my name is Caitlin Weiss.
And I'm Michelle Konkoly, and we're both recent graduates of Sidney Kimmel Medical College at Thomas Jefferson University in Philadelphia.
And today we'll be sharing our work on the clinical impact and patient experience of a transition to telehealth-based primary care.
We'd like to acknowledge our co-authors, Bridget Sikan and Alex Fossey, and our faculty mentor, Dr. Mary Stevens, who was the clinical and research lead on this project.
In March of 2020, Jefferson's Continuing Care Program, or JCCP, a medical home for adults with intellectual and developmental disabilities or other complex childhood onset conditions, had to transition to telehealth almost overnight due to the COVID-19 pandemic.
We hypothesized that, though sudden, this transition may be readily accepted by patients and caregivers, as telehealth may allow for better caregiver involvement, familiar surroundings, avoiding the burdens of travel, and ready access to communication devices at home.
To explore this hypothesis, we conducted a chart review to understand what types of care was provided via telehealth and developed a modified patient experience survey to better understand any advantages or barriers that patients experience with this change.
All patients who had a telehealth visit from March 19th to May 1st were eligible for both the chart review and the survey.
Our results showed that 54 telehealth visits happened during this time period among 38 patients. A family or caretaker joined for 83% of the visits, 25% were audio only, while 75% were video calls.
Our patients sought care via telehealth for reasons common to primary care, including follow-up, sick visits, and to establish care. The visits had successful outcomes that are also common in primary care, including counseling, medication management, and referral to additional care.
With regards to our patient experience survey results, 14 of 38 eligible patients or caregivers responded. All respondents were satisfied with their visits and would use telehealth again and would recommend it to a friend. One respondent did not find telehealth easy to use. In the free response section, many respondents indicated a desire for more telehealth services in the future, including neurological and psychiatric visits, urgent care, and medication refills.
Overall, our results support feasibility and acceptance of using telehealth for providing primary care to this population. We're encouraged by the potential for telehealth to increase access to care for this often overlooked population. However, the limitations of our study included the small sample size and voluntary nature of the survey.
Moving forward, we're considering a focus group to better understand patient feedback and exploring how principles of universal design could make the telehealth interface easier to navigate.
We're grateful to Dr. Shruti Chandra, the Jefferson Center for Autism and Neurodiversity, and the Department of Family and Community Medicine for their support with this project. Thank you.